Hi, I'm Dr. Tan Yiping. I'm a consultant obstetrician and gynecologist. Next will be the most important question. Can I prevent uterus cancer? So first of all, you need to ask yourself, are you at risk? If you are at risk, then you better prevent. No? Because it's better to prevent than wait until pre-cancer, then get treatment. Because get treatment, then you may need to go through some form of surgery. Most of the time, cancer or pre-cancer also need some form of surgery. It's just a matter of small surgery or big surgery only. Number one, if you are overweight or obese, change that. Don't continue with overweight or obese. If you can lose your own weight, good. If you cannot lose your own weight, seek professional help. Look for people who work on losing weight. If you remember in my last talk, we have primary prevention and secondary prevention. Primary means I don't want to have any cancer coming or even pre-cancer. So primary prevention. So number one, lose weight. Number two, make sure your period is regular. Because if your period is regular, then you don't have to worry about this cancer coming. So we have to use some form of hormones to make your period regular back. No choice. It has to be hormones. Why? Because birth control pill give you every month menses regularly on the dot. And birth control pill, the combination of the estrogen and progesterone already all calculated for. It is well balanced. The other way is to take long-term or to use, I don't want to use the word take, to use long-term progesterone. For example, you can take the birth control injections, you can take implanon, all these are progesterone. You can also take progesterone tablet long-term, which is the progesterone only pill, a form of contraception as well. Or you can put a Mirena inside your uterus, which is again progesterone long-term. All these are birth control. Number three, have more kids, have more children. Why? During pregnancy, everything balances out. Breastfeeding is another way. Breastfeeding, the estrogen is suppressed all the way down. So the more children you have, the longer you breastfeed, the more you can prevent uterus cancer. So I mentioned earlier, it can be a bit hereditary. Why? Number one, we tend to see a lot of people when they are fat or obese, it tends to run in the family. Diabetes tend to run in the family. As a result, PCOS also runs in the family. So uterus cancer also runs in the family. So because of that, uterus cancer does have a bit of hereditary. But first of all, you need to clarify whether your mother or grandmother have uterus cancer or cervical cancer because of the confusion, as I mentioned earlier. So this is primary prevention of uterus cancer. Then what about secondary prevention? That means I want to detect early so I can start treatment. So how to early detect? Back to your yearly medical checkup with a gynae. Keyword is gynae. Not BP lab, PET lab, or any wellness center. To look for early changes of uterus cancer in the ultrasound scan, you really need to look for it. Number two, also, remember the four symptoms? Prolonged menses, heavy menses, intermenstrual bleeding, or postmenopausal bleed. The moment you have it, even one time, you must go and see gynae. Don't wait until 5 times, 6 times. Secondary prevention means see gynae early. As long as you see us early, we detect at endometrial hyperplasia stage. Very easy to treat. How to treat? We most likely will use progesterone. Just now I mentioned progesterone tablet. Put progesterone inside your uterus. That is my favorite. Putting Mirena is my favorite. Why? Because not so much side effect. Because now the progesterone is in the uterus. I didn't swallow it. I didn't take a jab for it. I didn't put it in as an implant. Because progesterone in any other ways, when you swallow, sure, the progesterone will run around the whole body, right? And the dose in your body actually be quite high, so people do talk about side effects. But if I put in the uterus, then the progesterone is concentrated at your uterus, treating your endometrial hyperplasia. And you don't need to worry about side effects because it hardly enter your body. It hardly enters your bloodstream, so it doesn't go around your whole body and give you all the side effects of progesterone. But of course, once you have uterus cancer, then it's a different story. But because pre-cancer already, they give you all these menstrual problems, so early stage uterus cancer, easy to treat. Very often, just one surgery will do. Hardly need to go for chemotherapy or radiotherapy. So uterus cancer is the nicest cancer to get. So if you have a choice to choose, always choose uterus cancer, okay? So I hope you understand all what I have to say. So prevention is very easy. So that's all for today. Thank you and bye-bye. Bye-bye.